Welcome to this session in the Research Onboarding Orientation. My name is Beth Johnson. I'm the University Director of the Human Research Protection Program here at IU. This session will focus on the Office of Research Compliance. The Office of Research Compliance takes a collaborative approach to compliance. We seek to partner with IU researchers to ensure that IU conducts research activities in a manner that's consistent with both regulatory and institutional requirements, and that all research conducted at IU is done with the highest integrity. The Office of Research Compliance is a university-wide office that contains several units: the Animal Care and Use, or the IACUC office, the Conflict of Interest office, Export Control, Institutional Biosafety, Radiation Safety, Research Integrity, and the Human Research Protection Program. Today we'll be focusing on the Human Research Protection Program and more specifically the IRB office. If you need information about any of the other offices or areas within the Office of Research Compliance, please visit our website. The Human Research Protection Program at IU is nationally accredited. We have staff on the Indianapolis and Bloomington campuses, but we function as one office, with staff in those offices serving researchers on all 7 of IU's campuses. The HRPP supports 7 institutional review boards here at IU. We have 4 biomedical boards, 1 social behavioral board, 1 board that reviews non-compliance reports specifically, 1 emergency ad hoc committee that can convene on very short notice to review important, often biomedical studies that need immediate review, and the IRB Executive Committee, which supports each of these boards. Overall, the HRPP is supported by the Office of Research Compliance. However, the HRPP encompasses more than the Office of Research Compliance. It encompasses all of the researchers who conduct research here at IU and at our affiliates. The role of the IRB is to protect human subjects. The IRB is not charged with carrying out scientific review of protocols, except to the extent necessary to ensure that risks to subjects are minimized and that the risk-benefit ratio associated with the research is appropriate. In carrying out this role, the IRB has the authority to approve or disapprove research. Often, for research that is reviewed by the convened committee, modifications are requested to make the research approvable. Additionally, the IRB conducts continuing review on a yearly basis if that is required by the regulations based on the risk associated with the research. The IRB must also approve any changes in research before they can be implemented by the study team. This includes any changes, no matter how small. Additionally, the IRB is charged with evaluating unanticipated problems that occur during the course of conducting the research study. This may include deviations, unexpected adverse events, subject complaints, suspensions, or other problems that can arise during the conduct of the research. The IRB also evaluates reports of noncompliance with institutional requirements and the federal regulations. The IRB has the authority to suspend or terminate approval of research. If the IRB makes that determination and does suspend or terminate research, that decision cannot be overturned by any other institutional official. The most important question is whether a particular project requires human subjects approval. Projects require IRB or Human Subjects Office approval if they meet the regulatory and IU policy definition of human subjects research. Research is defined as a systematic investigation that is designed to develop or contribute to generalizable knowledge. This definition excludes certain activities, such as single-patient case studies and quality improvement and quality assurance activities. Human subjects are defined as living individuals about whom information is gathered, either through intervention or interaction with that individual, or through accessing identifiable private information. If both of these pieces are present, IRB review and approval will be required prior to initiating the project. In a few situations, our office's review and approval may be required even if you don't meet the human subjects research definition. A few of those situations are when de-identified human specimens are being used in a project that may be FDA regulated. Additionally, HIPAA compliance may require a waiver of authorization or particular requirements be met for the use of decedent PHI. Additionally, Some journals or suppliers of specimens or data will require confirmation from our office that a project does not meet this definition of human subjects research before that article will be published or before those specimens or that data will be released to you to use in your research project. We can accommodate all of these types of requests, and we have processes for getting you the approval that you need. Failure to obtain IRB approval when it is required can have serious consequences, both for the individual researchers and for the institution. If a researcher does not obtain IRB approval before conducting a human subjects research study, any data that is gathered as a part of that research project cannot be used for research purposes. This means it will not be able to be published or presented in any format. More and more journals are asking for this type of documentation before accepting manuscripts for publication. Additionally, the IRB can impose sanctions on investigators who are in noncompliance with the regulations. This could include a prohibition on being able to serve as a principal investigator on future research studies or increased monitoring or auditing responsibilities for future research. Additionally, for federally funded or federally regulated research, failure to obtain approval may be considered serious noncompliance, which may require reporting to the FDA or OHRP. To submit a project for IRB review and approval, the KC or Quali-COEUS IRB system is used. This is an online electronic submission system that is accessed via one.iu.edu. Before submitting a project in the KC IRB system, all investigators must complete city training and a conflict of interest disclosure. Additionally, for certain projects, scientific review may be required before IRB review is requested. The KC IRB system includes web-based smart form questionnaires with branching logic designed to collect information specific to your research project. Additionally, study documents such as the protocol, informed consent, HIPAA authorization, recruitment materials, and other study documents are attached in the system for the IRB's review and approval. For some research, scientific review is required before IRB approval can be requested. This includes research that is conducted at the Simon Cancer Center utilizing either their resources or patients. Additionally, greater than minimal risk biomedical research, which has not undergone a separate peer review process, will be required to seek scientific review from the Indiana Clinical and Translational Sciences Institute or the CTSI Scientific Review Committee. Peer review may be review by a federal funding agency, such as NIH, or protocol development and review by a for-profit entity, such as a pharmaceutical company. If required, scientific review must be completed prior to submitting a study to the IRB for review and approval. To submit a study for IRB review and approval in the KC IRB system, we highly recommend reviewing our training guides located on the website. Once you have submitted a study in KC IRB, an initial review is completed by Human Subjects Office staff who check to ensure that all investigator requirements, including city training and conflict of interest disclosures, have been met. Once those investigator requirements are satisfied, the item is assigned to a Human Subjects Office screener for pre-review. That screener will review the submission and request any revisions or additional information via KC IRB. Once the pre-review process has been completed, the item is assigned to an IRB member for review, depending on the level of review required for that protocol. In certain circumstances, the IRB member may have additional questions or requests for revisions that will be communicated to you through the KC IRB system. Once review is complete, you will receive a KC IRB notification regarding approval of your project. The Human Subjects Office acts as the administrative support office for the IRB. The mission of the Human Subjects Office is to create an atmosphere of respect for and awareness of the rights and welfare of human research participants. We seek to inform researchers about the applicability of the regulations and ethical principles to their research, to educate students, faculty, and staff who conduct human subjects research regarding these requirements, and to continually develop new approaches and new processes to better serve our human subjects participants and our researchers. The HSO pre-review process is focused around these missions. The HSO serves as a liaison between the research team and the IRB reviewer assigned to that protocol. The HSO screener will complete a review of the KC-IRB submission. Their focus will be on the clarity of the responses provided in the questionnaire, the consistency of information across the KC-IRB submission and the attached study documents, and compliance with regulatory requirements, which may include FDA regulations, HIPAA, and FERPA when they are applicable to a particular research project. The goal of the HSO pre-review process is to first ensure that regulatory and institutional requirements are met for that research project, and second, to obtain approval for the researcher as quickly as possible. To do that, the pre-reviewer will be focusing on what questions may be raised by the IRB reviewer during the review process. It is the goal of that screener to raise those questions during pre-review so that you can obtain an approval as quickly as possible. Once a complete submission is received by the Human Subjects Office, the pre-review process will be completed within 14 days of submission. Often we are able to complete pre-review sooner. If you haven't heard from a member of our staff within 14 days of submission, please contact us to inquire about the status of your project. The IRB turnaround time for various levels of review is listed here. For exempt new studies, approval is typically granted within about a week. For expedited new studies, about 2 weeks, and for full board new studies, about 4 to 6 weeks. These time ranges can vary greatly depending on the pre-review and the complexity of the project. These are simply averages. If you need review more quickly than our standard timeframes, we can often accommodate those requests. If you have one of these situations, please reach out to any HSO staff member or email our office at irb@iu.edu requesting high priority review. Comprehensive HRPP policies are included on the Office of Research Compliance website. Please review these policies in detail so that you are aware of all of the requirements applicable to your research. I'd like to highlight just a few of the PI responsibilities here, but there are many other important pieces of information included in the policies on our website. PI responsibilities include ensuring that research staff are qualified to perform any tasks that are delegated to them as part of the research project, ensuring that adequate resources are available to conduct the research, reviewing potentially reportable events, including adverse events and deviations, to determine whether they require reporting to the IRB. Additionally, PIs are responsible for ensuring that research is conducted in compliance with the IRB's requirements, the terms of any contracts related to the research, the ethical principles of the Belmont Report, and all applicable policies and regulations associated with human subjects research. The PI must also ensure continuous and timely communication between all members of the study team. The PI must also ensure that research is conducted in accordance with the approved protocol reviewed by the IRB. This includes not implementing any changes without prior IRB approval. Specifically, planned protocol deviations are not permitted. If a protocol deviation is identified, IRB permission must be obtained in advance of carrying out that deviation. Additionally, study closure must be reported to the IRB when research is completed. These are just a few of the PI responsibilities included in our policies. Please carefully review to ensure you are familiar with the requirements for conducting research here at IU. IU is very supportive of reliance in the single IRB review process. We are very familiar with and supportive of using external IRBs when appropriate. Our policies permit reliance on another IRB for a wide range of reasons, including efficiency. For greater than minimal risk research, any external IRB that will be reviewing and approving your research must be qualified by the Office of Research Compliance Leadership. We have a specific process for qualification, and many IRBs have already been qualified by our office. Please reach out to us with questions about reliance or qualification of external IRBs. Additionally, for studies subject to the NIH single IRB policy, please reach out to the Human Subjects Office Reliance staff as early as possible in your planning process, preferably during budget development. There are very important considerations surrounding single IRB review that need to be discussed during that budgeting process. The contacts in the Human Subjects Office for Reliance and single IRB are Amy Waltz and Ryan Ballard. In addition to the Human Subjects Office, the HRPP or Human Research Protection Program includes the Quality Improvement Office within the Office of Research Compliance. The Quality Improvement Office seeks to evaluate and provide education to improve human subjects research processes, ultimately promoting a high degree of research compliance. The QIO staff work closely with investigators and research teams to ensure that the conduct of research is compliant throughout the life of the research study. This includes routine and for-cause auditing, clinicaltrials.gov registration and reporting, and clinical research billing compliance. Thank you for joining me for this brief overview of the Human Research Protection Program at IU. Again, my name is Beth Johnson. Please reach out to me with any questions at all about the Office of Research Compliance or our Human Research Protection Program. Thank you.